what if you're not ready for surgery? Is surgery ready for you? Is it the right time for surgery? What if I don't want surgery? What are the other options? Well, the first thing I'll tell you is that surgery is not the #1 treatment that I give for people for arthritis. The vast majority of my patients I don't do surgery on because there's plenty of good options. The options that most of you probably know about are anti-inflammatory pills, and there's so many different kinds of them that I can't go over each and every one of them right now, but if you come and talk to me, we can go over the different ones. But let's just say they're all some form of anti-inflammatory medication, and that is really my workhorse. I give those out almost like candy to people. Now there are side effects with them, and I don't take it lightly, but there certainly are side effects, and every patient I have to look at differently for the anti-inflammatories, and they work kind of. They're not perfect, they don't get rid of arthritis, they don't cure arthritis, they manage the symptoms, which is inflammation, which is one of the big problems with arthritis. The other thing that really is helpful for a lot of people, especially the first time or the second time around, is injections. And there's all different kinds of injections out there. There's cortisone injections, which is the one that most people have. And cortisone, again, is a kind of a generic term for an anti-inflammatory and a steroid and some sort of pain medicine. It's kind of a cocktail. And those injections work great. We can only do them every couple times a year. And usually the first and second time they work wonderfully for the knee. For the hip, they don't work quite as well. I do injections for the hip. You do it under an x-ray machine, and a lot of times I do it for diagnostic purposes, not necessarily for pain management. Sometimes it works, sometimes it doesn't. Now the last type of injections are the goo injections. They're rooster comb injections. There's all different kinds of them. But what they are is they try and mimic the sticky fluid in your joints, the synovial fluid, and they work well as well. They're not magic, they're not better than the cortisone injections, at least in my opinion, and they do have side effects. So I try most of these, if not all of these, in addition to weight loss and physical therapy before we even discuss surgery. And I think that's the best way to go about it. Try all of the non-operative things first, and if these don't work, then we talk about surgery.